So, you are young and healthy, and you're thinking that you would survive if you were infected with COVID-19. You're probably right about that. The odds are in your favor. However, who wants to be sick and hospitalized if you could prevent that altogether? You should get vaccinated because these vaccines are more than 95% effective at reducing infections, hospitalizations, and death from COVID-19. Even if you contracted COVID-19 and never developed symptoms, you could be a carrier of the virus and infect those who are at risk and those you care about. Like most vaccines, even if you were among the unlikely few who did get the infection, the COVID-19 vaccine lessens the severity of the disease and reduces the chance that you would unknowingly carry the virus to infect someone else. I always say, getting a vaccine isn't just about you, it's about those around you too. This is a way to protect your loved ones, those in our society who are among those more vulnerable and maybe wouldn't fare as well if they were infected with COVID-19. As a society, if we can reach population immunity, then we will have enough immunity to adequately protect those who are not able to get vaccinated due to life-threatening contraindications to the vaccines. By getting your vaccine, you will help not only you, but also your community to stay safe and healthy. No, none of the authorized and recommended COVID-19 vaccines or the vaccines currently in development in the United States contain the live virus that causes COVID-19. This means that these vaccines cannot make you sick with COVID-19. COVID-19 vaccines teach your immune system how to recognize and fight the virus that causes COVID-19. Sometimes this process of teaching the body to fight the virus can cause symptoms which some people may call side effects, such as fever, muscle aches, or headache. These symptoms are normal and they're temporary. They're signs that the body is building protection against the virus that causes COVID-19. It typically takes a few weeks for the body to build immunity or protection against the virus that causes COVID-19 after vaccination. That means it's possible a person could be infected with the virus just before or just after vaccination and still get sick. This is because the vaccine has not had enough time to provide protection. No, COVID-19 vaccines do not change or interact with your DNA in any way. There are currently two types of COVID-19 vaccines that have been authorized and recommended for use in the United States: messenger RNA or mRNA vaccines and a viral vector vaccine. Both mRNA and viral vector COVID-19 vaccines deliver instructions or genetic material to our cells to start building protection against the virus that causes COVID-19. However, the material never enters the nucleus of the cell, which is where our DNA is kept. This means the genetic material in the vaccines cannot affect or interact with our DNA in any way. All COVID-19 vaccines work with our body's natural defenses to build immunity against the disease. Yes, if you're trying to become pregnant now or want to get pregnant in the future, you may get a COVID-19 vaccine when it's available to you. There is currently no evidence that COVID-19 vaccination causes any problems with pregnancy in humans, including the development of the placenta. In addition, there is no evidence that fertility problems are a side effect of any vaccine, including the COVID-19 vaccines. Like all vaccines, scientists are studying COVID-19 vaccines carefully for side effects now and will continue to study them for many years. After recovering from COVID-19 infection, natural immunity has been measured clearly out to 90 days after the last day of symptoms. Some studies are now detecting antibodies present in the blood out to 8 and 10 months after infection. However, little is known as to whether this confers actual protection from the infection, like that is demonstrated by the vaccine. The current CDC recommendation is to get the vaccine after recovering from COVID-19 infection, at least within 90 days after that last day of symptoms. This time frame may expand as we learn more. So far, vaccine has demonstrated excellent protection against common variants of the virus in the United States. These variant strains of COVID-19 are those more likely to cause second infections in those who have already experienced COVID-19 infection. This is another reason why those who have already been infected with COVID-19 would benefit from getting the vaccine. This is a great question. The answer is we don't know yet. Scientists are exploring whether a booster shot will be needed and at what frequency, like yearly or more or less often. At this point, we have a good evidence for protection out to at least 6 months or more after vaccination. The CDC is going to make recommendations when sufficient evidence is available. If you look at the average time it took to get a vaccine fully approved by the FDA prior to the pandemic, you would note that it typically took about 5 or more years before a new vaccine could actually be administered to the public. With the COVID-19 vaccines, they were made available to the U.S. public by way of emergency use authorization, not FDA approval, much quicker than this, which makes one pause to ask, how did they move so fast? With the federal initiative Operation Warp Speed, many government and non-government agencies, companies, and organizations collaborated to help make it happen quickly and safely. Because the virus was so rampant, these organizations had fertile ground for real-world study. Thankfully, lots of people at risk for COVID-19 infection were willing to test the vaccine, which made it easier to study and quicker to get the needed data to evaluate if the vaccine worked and if it was safe. To give you an idea of how firmly we can trust the data, most vaccines have to prove that they reduce the rate of the disease by 50% in order to get FDA approved. With the first 2 COVID-19 vaccines available in the U.S., they achieved the 50% reduction with 1 dose and achieved approximately 95% reduction in infection with 2 doses. Safety was also evident in these studies. With safety, we always need to look at negative effects of the vaccine in light of negative effects of the disease or the infection itself. In each scenario so far, the vaccine effects have occurred at a rate far less than the rate of the same effect when caused by COVID-19 itself.